Hello friends, I am Dr. Partharanjan Das, Medical Director of Kolkata Women's Clinic. Kolkata Women's Clinic is an infertility institute and we are going for last 15 years. We are giving the service of infertility uh, treatment, laparoscopy, IUI, IVF, ICSI, sperm donation, sperm freezing, embryo freezing and all other activities. Now in a nutshell, if we say what's about infertility, so infertility, it can be defined as an inability to conceive the pregnancy without any contraceptives in 1 year, but it's not fixed for all the ages. Say for example, if the patient's age is more than 35 and they are not being able to conceive within 6 months, they can go to the doctor or the infertilologist. Now, for the causes of infertility, we can see there are multiple causes. There are male infertility, female infertility, combined causes, unexplained factors. So all are equally responsible right now. If we say about male infertility, then it's say about 30% cases are responsible for the infertility overall, male infertility. What is it? In male infertility, we can find there are problems in the sperm. We do the test of semen and it's been found that there are motility problem, morphological problem, count problem. Number two is that if we say about the infertility, the female factors, there are ovulatory problems, there are tubal problems, there may be problems in the uterus also. So it's called the anatomical problems. There may be hormonal problems also, and there is problems of the uterus, say around, say for example, adenomyosis, where the thickness of the myometrium is much more. And if we talk about endometriosis, endometriosis is currently much more problem when the patient comes around with the problems of severe abdominal pain during menstruation, where the blood flows through the tubes inside the peritoneal cavity and forms the endometrioma or the ovarian cyst. So if we can find it, it's a replica of the female reproductive tract. So this is the vagina, this is the cervix, this is the uterus, this is the tubes or the fallopian tube, this is the ovary. Now the problem arises from, if the problem arises from the vagina, it can be a transferred septum inside the vagina due to some kind of Munedian abnormality. If we go further upward, there may be any kind of cervical polyp or like that, so we have to examine that. If we go by hysteroscopy or an HSG, we can find out whether there is any kind of tube, polyps, infections or the gyptum inside the uterine cavity. And if we do an HSG or microsurgery, we can find out whether the tube is being blocked or not. If the tube is being blocked, the oocyte originated from the ovary will not be transported from the tubes, and ultimately no fertilization will occur and the embryo will not be transported inside the uterine cavity. So the problem arises if in the ovary, that means not good amount of a good oocyte is not being formed in case of polycystic ovary or an endometrioma, then the problem also arises and will be treated accordingly. So if we find out there may be problems in the ovary, there may be problems in the tube, there may be problems in the uterus also, there may be problems in the cervix and accordingly. So in a nutshell, we can say that there are various factors for the infertility and we can treat accordingly. Thank you.